I give you some stuff to put on there. You go.
You got the stuff.
Yeah. I was just throwing at him.
You got the stuff. I'm hot. And maybe after him, we'll let Megan talk for a few minutes. As you have your daughter here.
Hello everyone. Thank you for coming today. My name is Ryan McNeil, and I want to thank you for coming out and showing support for our healthcare system today. Universal healthcare has saved the lives of many Canadians over the decades, but sadly has always been neglected and used to fund the coffers of other programs and projects within provincial governments. Unfortunately, this has led to where we are now, with a nearly 35 million surplus projected in this province by the next quarter, but a premier saying they've tried everything to fix it, when all they've done is swap out ministers, fired an administrator or two, and said that the problem is fixed. One of the major reasons our healthcare is suffering is, of course, funding. But what I'm here today to speak about is the mistreatment of nurses and healthcare workers in our country as a whole that is driving people from the workforce and from the profession in droves. If you're looking for examples, you won't find many aside from patient and worker interactions in the news. But one of the biggest factors that I've heard from nurses and healthcare workers is managemental abuse, forced overtime, cancelled vacation time, verbal and in some cases physical abuse. And speaking out about it is a fireable offence. For those that didn't know, nurses were forced to work in the hospitals during COVID even if they tested positive, but they were put into the COVID units. This in turn put others at risk. This issue stems from favoritism and nepotism at the top levels of management and administration. We need better protections in place for nurses and medical staff when it comes to imposing management. Right now there's even a gag order on all horizon of the Talatay staff, so I'm told, not to speak about the state of our healthcare system. And that needs to change. We need to hear firsthand from the people that are living it day in and day out in order for us to be able to fix this issue. One other thing I feel needs to be said is we can no longer trust our provincial governments to safely handle this. Many agree it's time for the federal government to step in and mandate healthcare funding to be used strictly for healthcare, as right now that money can be put into a pool to use for whatever the province deems, such as the 10K annual raise that the Provincial Conservative Party got themselves just this year, such as corporate tax cuts that were given to corporations that made record profits over the last 2 years during the pandemic, and most recently in Ontario, where they are using public funds and taxes to pay for private clinics instead of spending it on public hospitals. I call on you, Prime Minister Justin Trudeau and NDP leader Jagmeet Singh. You both have the opportunity and power right now to enact such legislation to protect us and future generations from this happening again and from it continuing to happen. Yourself and your parties claim to act for the people as the House majority with your coalition. Show us you mean that, and show us you will do what needs to be done, as you'll be acting in our interest as you should be, unlike Mr. Higgs when there's only enough public peer pressure put on him. In closing, I'd like to thank everybody that came today. Megan Mitten, Bob, thank you very much for coming today, and that's what I have to say.
Thank you.